So in this session, we are going to look at the pharyngeal apparatus, and under the pharyngeal apparatus, we are going to look at the pharyngeal arches, the pharyngeal clefts, or the pharyngeal grooves, also the pharyngeal pouches, and the pharyngeal membranes. And you should also know the adult derivative of each of these. So welcome all. My name is Wallace Munyeri, and I'm the redactor. So let's start. Let's start with an overview. So let me take a pointer. The pharyngeal apparatus usually consists of pharyngeal arches, pouches, clefts, or the grooves and membranes. Now, all these structures contribute largely to the formation of head and neck, and they usually appear in the fourth week of intrauterine life as surface elevations on the lateral wall of the primitive pharynx, caudal to the stomodium, but rostral to the cardiac ridge. Okay. So these elevations are termed as the pharyngeal arches. Then we have evaginations of the endoderm between these pharyngeal arches on the inner aspect. Now those evaginations, they appear like pouches. So the name pharyngeal pouches applies. Okay. Then we have invagination of the ectoderm between these pharyngeal arches on the outer aspect, and they are lined by the ectoderm, that is, and they are known as the pharyngeal grooves or the pharyngeal clefts. Okay. Now, initially, the pharyngeal arches are confined only to the lateral wall of the primitive pharynx, but with the time, they usually extend ventrally and fuse with their counterparts of the opposite side in the floor of the primitive pharynx to form horseshoe-shaped cylindrical bars, which are usually 6 in number at first. Then, with time, the fifth arch usually degrades and eventually disappears. Okay, and only 5 pharyngeal arches remain. That is, and they are named in a craniocaudal sequence. That is, first pharyngeal arch, second, third, fourth, and the sixth. The fifth regresses. So now let's explain these features of the pharyngeal apparatus. Now, what are pharyngeal arches? First, there are 5 in number: the first, second, third, fourth, and the sixth, and they are present in the lateral wall and the floor of the primitive pharynx. Then we have the pharyngeal clefts of the groove, which are invaginations of the ectoderm between the pharyngeal arches. Then we have pharyngeal pouches, which are evaginations of the endoderm in between the pharyngeal arches internally. Okay. Then we have the pharyngeal membrane, which they are usually located between the two adjacent arches where pharyngeal cleft and pouches are opposed to each other. Let's look at that in a diagram. Then here you can see here is the wall of the primitive pharynx lined by the endoderm internally, then mesoderm, then ectoderm. Okay, then we have these elevations. These are your pharyngeal arches. Then in between the pharyngeal arches externally are your pharyngeal grooves or clefts, then which are invaginations of the, is in blue is the ectoderm, then in red is the endoderm. Okay, and the pouches between the pharyngeal arches internally are the pharyngeal pouches. Okay, then you have this area, this or this or this. Those are your pharyngeal membranes. Okay, so pharyngeal arches, these are the horseshoe-shaped cylindrical bars in the lateral wall and the ventral walls of the primitive pharynx. Now, pharyngeal arches provide support to the wall of a primitive pharynx laterally as well as ventrally. Now, components of each pharyngeal arch. Each pharyngeal arch must have the following. It will have a core of mesoderm. Now, this core of mesoderm will be derived from the palaxio mesoderm and neurocrest cells. Now, It also has a cartilaginous rod or bar, which is derived from the neurocrest cells, the neurocrest mesenchyme. It will also have a pharyngeal artery, which will arise from the corresponding truncus arteriosus of the primitive heart. It will also have a nerve, which is derived from the hindbrain vesicle. Remember, during the 4th week, the brain is still developing, okay? Now, here you can see components of pharyngeal arch. They will have an artery, a cartilaginous rod, then this muscle, which is being derived from the core of mesoderm, that is derived from the paraxial mesoderm, then also a nerve from the hindbrain vesicle. You can see here they are usually located, okay? And they are located between the stomodium and the cardiac bulge, and they are 5 in number: the first, second, third, fourth, and the sixth. The 5 usually disappear. Okay. Now, what are the fate? What is the fate of these pharyngeal arch components? Now, the arch mesoderm derived from paraxial mesoderm will give rise to most of the muscles of the head and neck region, okay? But the arch mesoderm, which is derived from the neurocrest cells, will give rise to the skeletal elements and connective tissue of the head and neck region. Then the cartilaginous rod of the arch forms the skeletal derivatives of the arch. Now, part of that cartilaginous rod will form permanent skeletal elements such as bone and cartilage, whereas part of it will disappear. And also, remember this cartilage is hyaline cartilage, and hyaline cartilage has a perichondrium. The perichondrium may persist to form a ligament or a raphe. Then the arch arteries are usually connected ventrally to the ventral aorta. Then they pass around the primitive pharynx to open into the dorsal aorta. Now, most of these pharyngeal arteries, most of them disappear. Others persist to form a definitive arteries in the adult. Then the nerve of the arch usually provides motor innervation to skeletal muscles derived from the arch, and sensory innervation to the skin and mucosa derived from the arch. Now, these are the nerves to the pharyngeal arches. To the first arch, we have the trigeminal nerve via the maxillary and mandibular nerve. Then we have to the second arch is the facial. To the third is the glossopharyngeal. To the fourth is the superior laryngeal, a branch from the vagus nerve. To the sixth is the recurrent laryngeal, also from the vagus nerve. Okay. Then you find some text saying that these nerves, the ones I've stated right now, sorry for that. Those nerves I've stated right now, you find some text calling them post-traumatic nerves. They say that morphologically, each arch has a post-traumatic and a pre-traumatic nerve. The pre-traumatic nerve lying along the caudal border of the arch, and the post-traumatic along the cranial border. They say that all pre-traumatic nerves disappear except that for the first arch, which persists as the chorda tympani. Okay. Now the arch cartilages. The first arch cartilage, there are usually 5 of them, but the 4th and the 6th, they usually fuse to form cartilages of the larynx. The first arch cartilage is known as the Marquez cartilage. The second, the Reichert's. There is no name for the third. It's just the third arch cartilage. Then, now here are the adult derivatives. Now the first arch, which composes of mandibular and maxillary processes, the nerve to it. The post-traumatic nerve are the maxillary and mandibular nerve. Then the pre-traumatic is the chorda tympani nerve. Now, the core of mesoderm derived from the paraxial mesoderm will give you these muscles of mastication, namely temporalis, masseter, medial and lateral pterygoids. It will also give you your mylohyoid muscle, the anterior belly of digastric, your tensor veriparatini, also your tensor tympani. Then the skeleton, the one from the from the mesenchyme of the maxillary process will give you your premaxilla, your maxilla, your zygomatic bone, and part of the temporal bone. Then that from the mandibular process will first form the Merkel's cartilage. This is the cartilaginous rod for the mandibular process. Then the mesenchyme that surrounds the Merkel's cartilage will undergo intramembranous ossification to give rise to the mandible. Note that the mandible is not formed from the Merkel's cartilage. Mandible is formed from intramembranous ossification and not endochondral. Please remember that. Let me repeat that. This mandible is not formed from the Merkel's cartilage. Rather, it is molded from the mesenchyme surrounding the Merkel's cartilage. Then the Merkel's cartilage disappears, but the dorsal part of the Merkel's cartilage will undergo ossification to form your malleus, incus, also the spine of sphenoid bone. Okay, then the perichondrium, part of the perichondrium will persist to form the following ligaments: anterior ligament of malleus, also the sphenomandibular ligament. Now the second arch, nerve, facial nerve, muscles which are derived from the core of mesoderm, from paraxial mesoderm, the muscles of facial expression, the ones I've put in bracket, and others, also the posterior belly of the gastric, also the stylohyoid muscle, also the stapedius. All of them are innervated by facial nerve. All these muscles by there are innervated by the mandibular nerve. Then the dorsal part of the Reichardt's cartilage will give rise to the steps, styloid process, whereas the ventral part will give rise to the lesser conus of hyoid bone or the lesser horn of hyoid bone, also the superior half of the body of hyoid bone. Then the part of the Reichardt's cartilage between the ventral and the dorsal part will degenerate, but the perichondrium will persist to give rise to the stylohyoid ligament. That arch, nerve to it, glossopharyngeal, muscle, stylopharyngeus. The third arch cartilage, the ventral part, will form the greater conus of hyoid bone and the lower half of the body of hyoid bone. Okay, the other part will regress, will disappear. Then the fourth and the sixth arches. Now, superior laryngeal is the nerve to the fourth arch, the current laryngeal to the sixth. Now, the core of mesoderm from the fourth arch will form the following muscles: cricothyroid, levator veriparatini, and your pharyngeal constrictors, your superior, middle, and inferior. Those ones, how many muscles are those? 5: cricothyroid, levator veriparatini, superior constrictor, middle pharyngeal constrictor, inferior pharyngeal constrictor. All those 5 muscles originate from the fourth arch. Okay. Then from the sixth arch, the mesoderm will form the all intrinsic muscles of the larynx, except cricothyroid. Remember, cricothyroid is also an intrinsic muscle of the larynx, but it is derived from the fourth arch. Examples of intrinsic muscles of the larynx include your transverse arytenoid, your posterior and lateral cricoarytenoids, your thyroarytenoid, such muscles. Then the fourth and the sixth arch cartilages, remember, they fuse to form your laryngeal cartilages, namely thyroid, cricoid, your arytenoids, your corniculate, and your cuneiform cartilages. Then the rest part disappears, also the perichondrium, no ligaments are formed. Then here we are. Now structures derived from the first arch, from the dorsal part of Merkel's cartilage, your incus, malleus, spine of sphenoid. Then perichondrium, sphenomandibular ligament, also the anterior ligament of malleus. Then you can see the mesenchyme that was around the Merkel's cartilage is the one which will undergo intramembranous ossification to form your mandible. Then from the Reichardt's cartilage, dorsal part will form steps, styloid process. From the ventral part, we will form the superior half of hyoid bone, the body of hyoid bone, and the lesser horn of hyoid bone. Then the part in between will regress but the perichondrium will persist to form your stylohyoid ligament. Then from the third arch, it will form only the ventral part, which will form the lower half of the body of hyoid bone and the greater horn of hyoid bone. Then the fourth and the sixth, they fuse to form your laryngeal cartilages, thyroid, cricoid, arytenoid, cuneiform, corniculate cartilages. Then derivatives of the pharyngeal pouches. Now, the first pharyngeal pouch, now the proximal part will form a dilatation known as the tibial-tympanic recess, which will give rise to two structures, your middle ear cavity or your tympanic cavity and the mastoid antrum. Then the proximal tubular part will persist to form the pharyngotympanic tube or your eustachian tube, your auditory tube, which will be connecting the tympanic cavity to the nasopharynx. Then the second pouch, it will form the palatine tonsil. Okay. In fact, the palatine tonsil, because palatine tonsil is lymphoid tissue, that lymphoid tissue is usually obtained from the mesoderm underlying the second pharyngeal pouch. The endoderm underlying it, the endoderm will form it will form that epithelium lining the palatine tonsil, your stratified squamous non-keratinized. Then the pouch, much of the pouch is obliterated, but will remain as the intratonsillar cleft. Then from the third pouch, which has two components, a cranial and a caudal. Then the cranial component will form your inferior parathyroid, your your caudal will form your thymus. Also, the same to the fourth pharyngeal pouch. Your cranial will form your superior parathyroid, your caudal will form ultimobranchial body. Ultimobranchial body, the cells here are neurocrest in origin, okay? They are neurocrest cells, which later migrate to the thyroid and give rise to the parafollicular cells, okay? Please remember this, that from the third, parathyroid 3 is inferior parathyroid, parathyroid 4 is superior parathyroid. Please remember that point. Then here you can see first pouch, pharyngotympanic tube, then the tympanic cavity or the middle ear cavity, and also the mastoid antrum. Second pouch, palatine tonsil and the intratonsillar clefts. That pouch, inferior parathyroid gland and your thymus. Fourth pouch, remember the parathyroids are from the cranial part. I'll find some text saying dorsal, no, ventral, but I don't like that. I believe it is cranial and caudal. Then from the fourth pouch, from the cranial part, superior parathyroid, from the caudal part, ultimopharyngeal body or your ultimobranchial body. Here you can see that from the third, remember these structures usually lose their connection to the pharynx, then they migrate. You can see from the third where the inferior parathyroid and thymus originated from, they migrate caudally. Thymus is headed to the mediastinum. Then as it heads, it will carry along first the inferior parathyroid. Then after some time, the inferior parathyroid will reduce its connection from the thymus, migrate to the thyroid, but at an inferior position. Then the parathyroid, which originated from the fourth pharyngeal pouch, will just move to the thyroid to form your superior parathyroid. Then the ultimobranchial, the cells, the neurocrest cells forming the ultimobranchial body, will migrate to the thyroid to give rise to the parafollicular cells or the C cells. Okay, now what are the fate of these pharyngeal clefts? Now, only the first pharyngeal cleft forms a structure. Only the first, it usually forms the external auditory meters. What happens to the rest? The second pharyngeal arch usually overgrow them, okay, and fuses with the epicardial ridge here, okay, to form the cervical sinus, which is lined by ectoderm. Then as the neck grows, the cervical sinus is obliterated, okay, and that's how the second, third, and the fourth pharyngeal clefts are obliterated as well. Now, pharyngeal membranes. Only the first pharyngeal membrane forms a structure, okay, and it usually forms the tympanic membrane, the eardrum, okay, and Remember, the pharyngeal membrane is composed of the three embryonic layers. It has the ectoderm externally, mesoderm at the middle, and the endoderm internally. Okay, the rest don't form any structures. Okay, so what is the fate of the pharyngeal arch arteries? Now, the first artery, will give rise to the maxillary artery. The second arch, higher density stapedial arteries. The third arch will give rise to the common carotid and the internal carotid. Now, the fourth arch, on the left, it will give rise to the aortic arch. On the right, the subclavian artery. Now, remember the nerve to the sixth arch, the current laryngeal. Ask yourself, why in the course of the current laryngeal, why is it that on the left, it will arch under aortic arch, and on the right, it will arch under subclavian artery? Sixth arch artery will give rise to the ductus arteriosus on your left and pulmonary artery on your right. So we have come to the end of that session, and I hope you have understood. And please subscribe for more anatomy and biochemistry content. So thank you.